Hi, everyone. Thanks for joining us here today. I have with me our friend Dr. Brent Roussin, and first of all, I would like to offer Manitoba's congratulations to the incoming President, Joe Biden, and to Vice President Kamala Harris on their inauguration yesterday. After the shocking events of recent days in the United States, it is important to celebrate a peaceful transition and to recognize the vital importance of a stable, forward-thinking government in our strongest ally in the United States. Today is a big day. Today we are able, thanks to Manitobans, to announce some changes to our restrictions caused by the COVID pandemic. These are cautious changes. They are changes that we're making to ensure that we can continue to protect and safeguard Manitoba lives. Today is a day of hope. It's a day of optimism because unlike virtually every other jurisdiction in North America, Manitobans have actually successfully bent the COVID curve. But it is also a day to recognize, as we are able to do this, to make these changes, that it is only going to be sustainable for us if we continue to do our duty, if we continue to do the right things, and then we will earn the chance to have more days like this as we move forward. We earned this day. Manitobans now have the opportunity to earn such days in the future as well. I'll pass it over to Dr. Brent Roussin. Thanks, Brent.
Thanks, Premier. Today we're announcing 5 additional deaths due to COVID-19. We have 1 from Prairie Mountain Health Region, 1 from Northern Health Region, 2 from Southern Health Santé Sud, and 1 from the Winnipeg Health Region. I'd like to extend my condolences to their family, to their loved ones, to their caregivers. Current 5-day COVID-19 test positivity rate is 9.2% provincially, 6.6% in Winnipeg, 198 new cases as of 9:30 a.m. today. The total number of lab-confirmed cases in Manitoba is 28,089. As we were discussing, modest changes are being made to the health orders. The entire province will remain at level red on the Restart MB pandemic response system. The current orders expire at midnight on Friday, and so these new orders will take effect first thing Saturday morning. The new orders will apply to Winnipeg, Southern Health Santé Sud, Interlake, Eastern, and Prairie Mountain Health regions. However, because of the current case counts and test positivity in northern Manitoba and many First Nations, we're going to not have these loosening of the restrictions apply to the north, including Churchill. The changes will include expanding the orders to allow increased personal connections and support for the well-beings of Manitobans. 2 designated people, this will be family or friends, will be allowed to visit a household. This is a slight change from Tuesday, and it means that only these 2 designated people can enter that household. It doesn't mean you can have 2 people in one day and a different 2 people the next day. You can choose the 2 people that will be allowed to visit your household. The orders will also allow outdoor visits of up to 5 people only, plus members of a household on an outdoor private property. This will allow funerals as well to have 10 people in addition to the officiant under clear COVID-19 protection protocols. For retail operations, the orders will be expanded to eliminate the essential items list. Stores will be able to sell any products if they maintain physical distancing between customers. The occupancy limits of 25% with a maximum of 250 people, whichever of those is lower. The orders will also be expanded to allow for basic services that promote physical and mental health for Manitobans. Non-regulated health services such as podorthists and reflexologists will be allowed to reopen. Of course, there'll need to be adequate physical distancing, requirements to collect information regarding contacts. Barbershops and hairstylists are able to reopen at 25% capacity with physical distancing and requirements to also collect information regarding potential contacts. So the entire province will remain at level red, critical. These current orders will expire at midnight on Friday, and new orders go into effect Saturday morning and will be in place for 3 weeks, taking us to February 12th. The orders will be posted online as soon as they are finalized and signed. So our collective progress in reducing the spread of COVID means we can undertake these very careful, very cautious reopenings at this point. But this has to be a gradual and cautious process. We do not want to be opening and then closing and then reopening again. Everyone's aware of the challenges that these restrictions have caused Manitobans. But we just cannot overwhelm our healthcare system. We cannot continue to lose so many Manitobans as the trajectory that we were on in October and November. And we'll reiterate, the businesses and facilities that are not permitted to open at this stage, this is not in any ways as a punishment. We know that Manitobans have put in a lot of effort. We know businesses did whatever they could to make their places safe. But we could see in October and November, despite that, we were on a very bad trajectory. So if we opened everything now to where we were in October, we will be back on that trajectory. So we need to do this in a very cautious and slow approach. So it's crucial that we follow these orders that are in place, and it's crucial that we follow those fundamentals that we're all well accustomed with. Staying home if you're ill. If you're ill, have the entire family stay home pending test results. Washing your hands, physical distancing, and if we continue to focus on those sacrifices, and all those fundamentals, and these sacrifices will pay off in the short term, so that we can start getting back and continue our progress on reopening. So thanks again to all Manitobans, and I'm going to pass it back to the Premier.
Thanks, Doctor. I'll reiterate what Dr. Roussin has said. The important thing here is to recognize we're making progress, and we're making changes cautiously for a reason. We want these changes to continue. All of us do. We want them to be sustainable. We don't want this to be a yo-yo effect where we're able to give you some freedoms back and then have to, because of increasing COVID numbers, have to take them away later. That's not the goal. The goal is to move forward and to make progress on an ongoing basis. You've earned the right to see that. Manitobans have, in the vast majority, done the right things and followed Dr. Roussin's advice. But I know that you've made major sacrifices, and we all have. And I know some of you will be disappointed today that you're only able to get together with 2 people because you have many friends and family you'd like to see and you'd like to visit, and you've been holding back the ability to do that out of respect for the rules. But let me explain why. It's important that we just have 2. 2 people is a fixed number. And the whole thing here is to reduce the number of contacts that we have. We know the contact tracing work has been really important in us tracking and being able to get ahead of COVID, and to stay ahead of it, we have to continue on that. So you might be thinking, well, over the next 3 weeks, I'd be able to see in 3 weeks, 21 days, two different people a day. And if you did that, you'd see 42 people. And, you know, that's not the only problem. The problem isn't just 42 people versus 2 people. The problem is, well, let me explain it to you this way. COVID doesn't work like that. Say you're a couple and you have another couple over, and the night before both of you had another couple over to your place. You're not getting together with 2 other people. Your gathering isn't 4 people, it's 8 people, because the indirect contacts you had the day before are added up. And as you move forward, if you keep going like that, if we relax these rules to allow this to happen, after about a week you'd be able to have a gathering with 500 people. They wouldn't all be in the room, but they would have all been in direct contact with the people in the room. And you see the problem that we would have. So we know that you want us to be cautious. We know because 100,000 of you responded to our survey and you gave us your views, and we are going to be cautious in this. We don't want to have a COVID get-together. We don't want to have a COVID comeback. We want people to be able to see some friends and identify too. And on your honor, that's what I'm asking you to do now. We don't have enough enforcement people to check every household, to check that you're following the rules. We're asking you to follow the rules because that's how we'll keep each other safe. So please do. Please respect that it's two. Identify those two. Use this opportunity to do some visiting and catching up. But remember that in 3 weeks' time, if we do the right things, there may be the opportunity to make further progress on this front. So I'm encouraging Manitobans to recognize there are real reasons for caution right now. You know, frankly, winter isn't even here yet. COVID variants, thank goodness, aren't here yet as far as we know either, but that's on the horizon. And our vaccines aren't here yet either, to be frank. They're going to be slow in coming, as I've said before. So those things aren't here yet, but COVID is here. It's here with us right now, every day. And so let's stay on guard. Let's make sure we keep doing the things we need to do. We're not out of the woods yet. We have to keep doing the things we've been doing to protect our loved ones, protect our community, and thankfully keep supporting our small businesses who've been through a rough patch and now have the chance to start to get back to doing what they do so well. So let's encourage our small businesses. Let's shop local when we can. Let's continue to give the opportunity for folks to get their lives back and for people to get hired back, because this is a big opportunity now for many to get their jobs back. Yeah, there's reason for hope, but we can't lose sight of the gains we've made and how we made them. So let's proceed with caution. Let's follow the doctor's orders. Let's stay home. Only leave home for essential purposes. Stay home when you're ill. Stay home if any member of your family is sick. Don't socialize with people outside your household. Wash your hands, cover your cough, practice physical distancing, wear a mask. You know these rules now. Keep following them. Keep up the great work. Happy to take your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from Global News, Marnie.
Good afternoon, Dr. Roussin and Mr. Premier. Obviously, restaurants not included. We're hearing some criticism from that industry as well as owners of gyms saying there's not enough consultation with the province and it's more of a one-way conversation rather than a two-way conversation. What's your response to their frustrations?
You know, you can certainly understand it. I can understand the frustration from Manitobans who are hoping to have be able to gather with more people, frustration to businesses that aren't able to open at this point. But like we said, the alternative is to getting back to that trajectory we had in October and November. So we know that you know, a lot of people in these industries have worked quite hard to make things safe and doing their best to do so. But that's where we were in October and November. When we open things up, when we increase the way Manitobans interact, when we increase the ways Manitobans can gather indoors for prolonged periods, we're going to see case numbers go up. And it's just, it's not a reflection on the efforts of those people. It's a reflection on the virus. So if we opened up all those things right now, it's very likely we would look back at where we were at the end of October and November. So we have to do this very cautiously, and we, you know, will continue to provide protocols and advice to industries as they, as we move forward with opening. But right now, we have to take a cautious approach.
Thank you for that. And also, when might we be able to see elective surgeries fully restart?
Well, you know, certainly they've been back performing elective surgeries. I don't have a date on when we would be able to get back to just full pre-COVID elective surgeries. You know, we'll maybe be able to provide some more information, but it's very unlikely we'll be able to provide a specific date to that.
From the Brandon Sun, Michelle.
Good afternoon. Dr. Roussin, would you be able to list the changes between the proposed restrictions on Tuesday and the finalized list from today?
You know, the only change on that is the specifics around the two people gathering. So we had talked about two people gathering within a residence. We sent the message that this should be considered a bubble type format, that we didn't want many groups of two visiting. But what we did was just clarified that in the orders, that it is actually a designated two people that would be allowed to visit any household.
Okay, thank you. And I have a reader's question. Can we get regular updates on percentage of transmission that is truly widespread and community-based? This info was shared daily in Prairie Mountain Health back when we had a spike in cases, and it seems perhaps one of the most helpful indicators for individuals to use to assess risk as restrictions start to loosen.
Yeah, so, you know, reporting of community transmission cases that we can't link to known transmission chains, we do have those numbers. We can present those. Presenting meaningful data on acquisition events is challenging because a large amount of our cases are by definition unknown acquisition. We do look back at where people were during the 2-week period before they acquired the case and try to draw some relation to that. But, certainly the community-based transmission is something that as our numbers start coming down, we'll be able to provide more details on.
From CJOB, Joe.
Hi there. I'm wondering if you can share what else may have been close to be added to have been added to the relaxing of restrictions list and may have just missed the cut.
No, don't really have that. The things that we put forth as proposals was what we felt was reasonable at this point. That was that sticking with our cautious and slow approach. So I don't have really any other things that I could list at this point.
Going forward, do you have a prioritization list for reopening? And if so, what would be near the bottom, like sort of last to come back?
Well, we're not going to speculate on where we're going moving forward. But what we do know and what we've come to learn and Manitobans have come to learn is that this virus spreads with prolonged indoor contact. And so venues that have prolonged indoor contact, crowded places, enclosed spaces, those are where a lot of the risk lies. So moving forward, that's the kind of thing we'll be considering.
From the Winnipeg Sun, Scott.
Good afternoon to both of you. Scott Billis, Winnipeg Sun. First question, I suppose, for Dr. Roussin. What indicators will you be looking at closely here, Shun? Like, I guess what would trigger us going backwards at this point? We obviously know what would trigger us going forwards, but what would trigger us going backwards, and how quickly would that clamp be tightened again if you start seeing, an uptick in numbers again?
Yeah, so I'll preface that is that the whole idea behind this very cautious approach is that we don't have to do that. Obviously, the protection of the health of Manitobans is our number one goal. But the indicators are much the same as what we've been following. So we've had a fairly stable numbers in our second wave related to the proportion of ICU cases, the proportion of admissions to hospital based on total cases. So certainly total cases are relevant, so we'll be following that. Test positivity is always something we follow, especially when test numbers are remaining stable, then the test positivity is also quite relevant. And then of course we have to look at the demands on our healthcare system. We're just getting back to some of that elective procedures that people have been waiting for, and that's because of the hard work of Manitobans driving these numbers down. So we have to be able to protect that. We have to be able to further expand that. So those are the type of things that we look at daily.
Thanks for that. And you spoke of Northern Health, and obviously another uptick in cases there today. What is the worry or the concern there that those numbers are going to eventually turn into more hospitalizations and start having, placing a burden on the healthcare system, just given the situation up there right now?
Yeah, when we look, certainly we're concerned about the cases there and and the communities that are affected. Obviously, when you see increasing cases, you're going to translate that into increasing admissions into hospital, and then start seeing that increased burden on the healthcare system. So a lot of things are in place to start to control those outbreaks and try to drive those numbers down. But definitely, it doesn't matter where the cases are in Manitoba. The overall case counts will eventually translate into increasing hospital numbers and ICU numbers.
Just to add to that, if I could, Scott, just as a comparison, since December 14th, when coincidentally one of our major Indigenous leaders proclaimed that public health orders didn't need to be followed in his case, till today, Manitoba First Nations Response Coordination Team reports that the percentage of new cases went from 36% in December on the 14th to 58% now. The percentage of ICU patients who were Indigenous went from 52% to 64%. The percentage of active cases went from 34%, more than double, to 73%. I say this while I also praise the work of virtually every other Indigenous leader in our province who has fought so hard to try to keep COVID out of their communities. I say this because it should remind all of us what happens when you run a victory lap too soon, or when you start to forget that public health orders matter. And again, I'm waiting for the federal government to come out and say provincial health orders have to be respected on and off First Nations communities, because that would send a clear message to everyone that that is the case, and that would assist our Indigenous leadership and the whole leadership team in making sure that we reduce the number of cases and hospitalizations and ICU patients and deaths in our province.
From CBC Radio Canada, Gavin.
A question for you, Premier Pallister. Will you commit to increased support for businesses that must remain closed? So say like a third bridge gap payment, for example?
Well, yes, we will continue to support our small businesses. We have done that. We'll continue to do that. The best support that they can get right now, I think, is to keep these COVID numbers down and to keep our curve bent so we can sustain our open, gradual strategy, and to make sure that our small businesses, many of whom will now be able to reopen and operate, can continue to do so. But we have some of the most generous programs in the country. Our finance department put together a detailed document evaluating that, so if anyone in the media would like to see a real comparison, they can have one. But the fact remains that these programs are small compensation, frankly, for the losses our small business communities have suffered. The lack of opportunity to be open causes real consternation among everyone, and I know that. As a former small business person, I understand that full well. But we're going to do everything we can to get this COVID curve staying down, and that's what we want. Our business leadership has told us they don't want a yo-yo effect. They want a gradual opening. I believe you're going to find very favorable comments from the business leadership of our province around these changes. They're a move in the right direction, and we look forward, with the help of Manitobans, to being able to do more.
Thank you, Premier. And yes, I would like that document. Second is a question for Dr. Roussin. What sort of feedback did you get to the proposed changes? We got a pretty detailed summary of the feedback on, I think it was on Monday or on Tuesday. Are we going to get something like that this time? And what did people have to say about these proposed changes?
Yeah, I think you can find that feedback on engagemb.ca. I think there was in our release today, there was some feedback on on the proposed changes, and you'll find that it was fairly a lot of support from Manitobans on these proposed changes. Again, on the very cautious approach. So I'll direct you to those couple sources.
And thanks to Manitobans who participated by engaging in Engage MB. Appreciate it. I think over 30,000 since these provisions were announced as planned just a couple of days ago. So thanks so much to Manitobans for being part of that exercise.
From CBC Manitoba, Bart.
Hi there, Dr. Roussin. Can you clarify something about the hair salons? A lot of them do nail treatments, body sugaring, other things. Nail salons aren't reopening. Can you expressly just state for the record that hair salons are to do hair treatment?
That's correct. So these the hair salons, barbershops can open, but they are limited to working on the hair.
Thank you very much for that.
Bartley, sorry, I'll just say Manitobans are looking forward to this new service being available to varying degrees. Eh, Brent?
Are you waiting for Dr. Roussin to say something else, Mr. Premier? That is not my second question.
Well, you go ahead then, sir.
Okay. Dr. Roussin, with the all the rules staying in place for Northern Health as well as the Churchill exclave of the Winnipeg Health region, what travel restrictions or additional enforcement of travel restrictions, either going up north or coming down south, or monitoring of patient transport will be in place given the increased or elevated infection rates in the north versus the south?
So we still have the northern travel restrictions in place. There won't be any changes to that in this iteration. We're not planning on any further travel restrictions. With patient transport, there's always precautions taken to ensure adequate PPE and screening is in place. So, and as far as enforcement, I can't really, speak to that. Certainly all the orders are able to be enforced, but these type of orders are always challenging. But as of right now, we haven't contemplated any further travel restrictions.
From the Canadian Press, Steve.
I've only asked two, Paul. I've only asked two. Mr. Premier,
Hi.
Sorry, I think you get to, Bart.
Sorry, there's some
Yeah.
talk here. My question is about the hospital numbers. Dr. Roussin, we're still seeing a big spike in the north. 100 cases today. As you mentioned, that's going to trickle down into the healthcare system. A percentage of that will enter hospital, and some may end up in ICU. What is your projection, given that we're still above the pre-pandemic capacity in ICU? What is the projection for ICU strain under these new orders?
Yeah, and so, I think that the trend in hospitalizations continues downward. Certainly we'd want it much quicker. But again, when you're looking at we are seeing increasing cases in the north, but at the same time as we're seeing decreasing cases in other regions. So we've seen fairly the stable proportion of people being admitted to hospital and admitted to ICU based on our total numbers. So our total case numbers are still in that downward trend. So we see much the same demands on hospitalizations as we have at this point, with expecting still that gradual trend as we keep these numbers going down.
And Premier, you've mentioned the help to business and the bridge grant that helped businesses that have had to close, and you're leaving the door open to a third round on the bridge grant. Is there more help coming for businesses that have been able to reopen and can now reopen, but at limited capacity? Because 25% capacity doesn't give you the same cash flow that 100% does.
No, that's true, yeah. We have had some programs offered last year, Steve. We've got Dana Spiring from Economic Development Winnipeg in conjunction with Chuck Davison, the Manitoba Chamber of Commerce head, working with our economic people to design some recommendations on programming going forward. That work's underway. Look forward to hearing their recommendations, because we're going to continue. As I said earlier, our finance department has calculated Manitoba leads the way in terms of per capita contributions to supporting small business support programs. But I emphasize again, the best thing we can do for our small businesses is bend that COVID curve.
From CTV Winnipeg, Michelle.
Hello. I just wanted to ask for a little bit more clarification on why you changed to the designated 2 visitors inside the home. And maybe can you expand a little bit? Like, if you're having 2 people over, can you yourself also be a part of a duo that's going over to someone else's home? What's the guidance on that?
Yeah, and so the change really isn't a change in in our messaging. We are going to have that limit of 2, which remains, and we're messaging that this should really be a bubble. This shouldn't be 10 groups of 2 in the same week. But we just put it in the order to be absolutely clear that this is 2 people. These are designated 2 people to the household. And so just to make that clear, that we didn't run into any of those difficulties. The orders will say that each household will have to designate 2 people. Our strong advice, again, as you hear about the number of contacts that can be as we start gathering, even in low numbers, but with different people, we see those number of contacts going up. Our messaging would be that should be the same 2 people. If you are, 2 people gathering in one household, the 2 people coming to your household should be from that same household that you're gathering. We want to keep those contacts down. So we wanted to provide some opening. Manitobans worked hard to have us loosen some of these restrictions, but we know if we just start gathering, increasing those contact numbers, we're going to start seeing October and November numbers again.
I wanted to ask about gyms and fitness facilities and government buildings. Do you know of any that are in provincially run buildings that have been open during the time that, a community-based gym? And are you reviewing to see if any are open in provincial buildings?
Yeah, I do think that this was reviewed, and I'm not aware of any.
From City News, Jonas.
Good afternoon, folks. For Dr. Roussin, as just looking at, we're back to school now. I mean, over the break, we had kids on remote learning, the older students. How are we going to balance, older students we've learned are more transmissible. They're back this week. How will we know, the impact of older folks back at school compared to community spread and all that moving forward? How do we balance that out?
Yeah, well, we do very thorough contact investigations when we have cases related to schools. So when we have a positive case, we do, quite a thorough case investigation, have people self-isolating, and monitor those contacts quite highly. So due to that, that's where we can say we haven't seen a lot of transmission within schools. So we've had very tight restrictions, and that's driven our numbers down and allowed us to keep our kids in school. I think it's very important that we have that ability to have that face-to-face learning, in-person learning for our kids. And like we've said before, the education sector has done amazing work to keep the schools safe for our children. And our contact and public health investigations continue to show that. We see cases, we just don't see a lot of transmission.
Thank you for that, sir. Just a follow-up, if folks are watching and saying our numbers dropped while the kids were out of school, how and they're worried about transmission, if they're worried about that maybe it was schools driving. I mean, they can be confident that, that wasn't the case.
Yeah, and certainly when we're looking at the younger kids, they make up a very minimal proportion of our case counts. And then again, we've when we saw numbers increasing in the November and December, we were always doing quite thorough investigations on cases in school, and we're just not finding a lot of transmission. So so from public health's view, our schools are safe. There's a lot of processes in place to keep them that way.
I'll just throw in a special shout out to our teachers for the incredible extra efforts they've put in through this time. Accommodating some distance learning obviously is one part of it, but there's a lot of extra work that's gone on, and really appreciate that. So thanks to our teachers, our administrators too, and the staff at our schools for the willingness to respond to the challenges and to do so with such strength and such grace.
From CHVN, Taylor.
Hi, good afternoon. Northern Manitoba is vast. It's mostly isolated. Majority of the communities are remote. People from Lynn Lake aren't exactly going to show up in the PAW, but going forward, be seriously considering looking at specific communities rather than the entirety of Northern Manitoba?
Like our message has always been, we don't take anything off the table. We're going to do what we think is best to protect the health of Manitobans. Right now in the northern region, there certainly are concerning outbreaks in specific remote communities, but that's not it. There are cases that are dispersed throughout the northern region. So for this iteration, it's our first return to a more regionalized approach to our public health orders for quite some time. And so we are providing some more of that targeting that we tried to do early on in the fall. And so right now we're going to include the entire north, but watch things quite closely.
I'll throw in Taylor on that one if I could, and just say much has been made out of percentage of vaccines out in Manitoba being lower. I would point out a couple of things. First of all, we've focused on the hotspots in the north. We've worked in partnership with our Indigenous leadership, medical leadership, to get those vaccines up there, but it's not the same thing dishing out a vaccine in St. Teresa Point or Puckatawagan as it is in some urban communities. So there's challenges there, and reporting back, we're improving on that so we get better reports back more promptly. But the people up in the northern communities that are working on delivering that vaccine are doing great work, and we thank them for that because we do identify, obviously, northern isolated communities as being, in many cases, hotspots right now for COVID.
Along that line, actually, obviously vaccines are very difficult to bring out to these communities, but what else is the province doing for these Manitobans?
Yeah, and so with this, it's the typical public health approach to outbreaks. We have case identification and isolation. So case identification, we have the rapid response teams, rapid testing available. We need to do contact tracing. So we've increased the work of public health nurses being in those regions. And then we have to effectively isolate cases and contacts. And so we've expanded our access to alternate accommodation settings and transport to and from. So it's the public health approach, but it just needed to be expanded, especially in these communities.
And on that one too, Taylor, we've been working very diligently and respectfully with First Nations community leadership and medical leadership from the get-go. And that has taken time to do, but it's important because the principles of reconciliation matter. And so that partnership is going to pay good dividends as we move forward. It already is paying dividends as we work together. We got more vaccines, thanks to Ottawa for that early on commitment to provide us with more Moderna vaccines because we can't move the Pfizer ones very easily. And those vaccines are a big part of how we're allocating to our hotspots in the north, but we're doing it respectfully in partnership with our Indigenous leadership as we move forward with the highest percentage of Indigenous population in the country of Canada, outside of the territories, obviously. We believe that approach is the right one, and we believe that's the one that will strengthen the ability and the willingness of First Nations community members to participate in the vaccine programs, for example, and other programs as we move forward.
From the Winnipeg Free Press, Carol.
Good afternoon. Premier, other provinces have publicly identified their COVID-19 vaccination czar or overseer. Why won't your government tell us who is Manitoba's vaccine czar?
Well, it's a great question, Carol. We have a team of civil servants bolstered by recruits that have come into the senior leadership from the military, from the private sector, from the nonprofit sector. There are so far about 1,700 Manitobans involved in the vaccine task force, and the efforts are monumental, and I thank everybody that's on that team for that. And of course, there's a dynamic reality too that planning's not the same as operations, and so some people have been involved in the planning process for months now that are now back to their day jobs, and others are coming in to help with the running of things like super sites and the dispensation of and rolling out of our fast teams to get moving once we get more Moderna. Our biggest limiting factor right now is, and I guess what I'm saying is, Carol, we'd like to get you more information, but we're very much focused on getting vaccines in people's arms right now.
Thank you for that. And another question for you, Premier. There have been problems with the vaccine rollout. The private company that twice sent healthcare workers to the wrong address. There have been trained nurses who applied to help as immunizers and were hired who are now being asked by a private firm that took over recruiting to reapply. And Manitobans are still waiting for the priority list to find out who gets vaccinated next. How do you see these concerns, and are you satisfied with the way the province is handling it?
I'm tremendously impressed by the work that's gone on, and the team that has designed this plan and is implementing it is working their tail off. These are dedicated people who deserve our support, who deserve our encouragement. I've told the media from the beginning, this is a first-time set-up new company that's going to have its challenges along the way. And profiling those challenges is fine, but not to the exclusion of giving praise where it's deserved. So for example, when you have a reporter go out and troll 20 people so they can find one who will complain, I guess I'd have to ask the question, is that honest journalism? You know, we have people here that are working their tails off day and night, hundreds of them. And I'm going to keep encouraging them because I think Manitobans want me to encourage them, because I think Manitobans are tremendously appreciative and thankful of their efforts.
Our final reporter this afternoon from CBC National News, Cameron.
Hi, good afternoon. Dr. Roussin, just want to follow up on the question I was asked earlier on indicators. You were asked what could possibly set this back. I'd like to ask you that from a different perspective. Where do you want to see these numbers when it comes to the test positivity rate, when it comes to ICU? Do you have a benchmark in mind for 3 weeks from now where you'd like to see those numbers?
You know, not a specific benchmark, but what we're, with this cautious approach, we still want to be on that overall trend downwards. And so 3 weeks from now, we want to see, you know, all of those indicators I mentioned still in a downward trend. It's difficult to predict, you know, what, you know, the specifics of what that trend would look like. But if we see a continued downward trend in all those indicators, then again, then we're at that position where we could further our cautious approach. So we don't have a set benchmark that we must see. It's going to depend on a number of factors, but we still want to see that overall downward trend.
Okay. And if I may, a question for the Premier. Premier, we've seen Premier Ford be pretty animated over the last couple of days in his criticisms of Pfizer, and today he's calling on President Biden to intervene. Do you see this as a matter that Prime Minister Trudeau should be taking up with the President when he has his first phone call with him tomorrow?
Yeah, the limiting factor here, as we've said repeatedly, is the number of vaccines available to us. Where our vaccine group, our task force, has established a mechanism. We can get every Manitoban vaccinated by, they're saying now, the middle of April, if we get the vaccines. So I'll be on a call with the Prime Minister this afternoon, and certainly I will, and other premiers will be very much raising this as the issue of key concern. We know that these measures that we are talking about today are necessary, and they're going to remain necessary to some degree as long as we don't have people vaccinated. We know that we don't have herd immunity on the horizon yet because the rollout is going to take literally months into the year. So it's critical that we pursue additional vaccines. Absolutely, that's a high priority. I want to say thanks to everybody, wind it up, and just say this. The reality of Manitoba's situation is that we have taken some of the greatest challenges. Our task force has taken on some of the greatest challenges first. Some of those challenges include, but are not limited to, establishing in partnership a First Nations vaccination strategy for our Indigenous people. That is something other provinces, to the degree that Manitoba has undertaken it, have not chosen to prioritize, but we have. Secondly, we are also very, very conscious of the need to follow the recommendations of the manufacturers of these vaccines closely. To get maximum effectiveness out of these vaccines, we want the second dose administered. So while people have been highlighting, I saw several articles in the Winnipeg Free Press, for example, highlighting the fact that we haven't got a high percentage of vaccines out compared to other provinces. Go on the ctv.ca website, ctv.ca, just for fun, and see which province is leading in terms of getting the second dose out. And you'll find it's Ontario, but you'll find close second is Manitoba. Why does this matter? Well, because the manufacturers are telling you that if you want 50% effectiveness, you put one vaccine in. But if you want 95% effectiveness, you put in the second one. Our vaccine team has designed a strategy so that we have security of supply. 2 points here. One, when supply is disrupted, as it has been in the last few days because of Pfizer's failures, what we are able to do is maintain our schedule of appointments and vaccinations because we safeguarded that system out of caution. We didn't put speed ahead of safety. We're vaccinating our most vulnerable Manitobans. We're talking about seniors in seniors' homes. We're talking about frontline workers who protect seniors in seniors' homes. So we're not going to sacrifice stats for speed. Now, the other thing to understand is, of course, that other provinces are not going to administer the second dose in the time that is recommended by the health experts. They are prolonging and delaying giving out the second dose so they can give more vaccines on a first dose basis. This could result in a reduced effectiveness. Our team has made the decision, I think quite rightly, to follow the science and to follow the manufacturer's recommendations and deliver the vaccines in the 21 or 26 days, whatever is recommended. So Manitoba's plan is getting more people 95% protected at the price of temporarily having a stat that doesn't look so good. But I think if Manitobans understand that, and I hope you do, you'll understand that we're going to put safety first. These are our most vulnerable people, and we want them protected with the second vaccine. So that's why we're following the strategy we are. I'm sure that our vaccine communications people will have more to say on this and any other issue you might like to raise. But again, I want to say thanks to Manitobans for following Dr. Roussin's orders, and thanks to Dr. Roussin for making those orders. We all thank you, Brent.